We respond to stimuli that originate from outside as well as inside us. We can classify these responses using two criteria: the origin of the response and the attention to detail of the response. Method of origin implies the response developed spontaneously or was learned as a result of unique experiences of an individual. Degree of flexibility means the response occurs automatically with little or no attention to detail, or the response depends on a detailed analysis of a situation. Using these two criteria, we can label our reactions as inborn automatic, learned automatic, or learned and flexible. Flexible implies the responses can vary based on the context of a stimulus. Inborn automatic reactions develop spontaneously and so are universal throughout a species. They include the many homeostatic reactions that regulate our internal environment, such as blood pressure, blood glucose levels, blood oxygen levels, and so forth. You didn't have to go to school to learn how to regulate your blood pressure. You were born with those reactions built within you, and they happen pretty much automatically. Other examples include the pupillary light reflex and accommodation reflex. The pupillary light reflex develops in the fetus during the last trimester of pregnancy. We don't have to go to school to learn how to adjust pupil size to local lighting. And this reaction is largely beyond our conscious control. That's why the eye doctor places drops in our eyes to block the response in order to view the retina with an ophthalmoscope. Stretch reflexes are another example of a type 1 reaction. When a muscle is suddenly stretched, as when your doctor taps your quadriceps tendon, the nervous system tells the muscle to contract. Then you must explain to your doctor that you didn't mean to kick him in the face. The stretch reflex is the simplest of all neural reflexes. The sensory neuron synapses directly on the motor neuron, eliminating the interneuron and hastening the reaction. You don't need your brain for this reflex. It's a spinal reflex. The infant's fear of falling is a type 1 reaction that develops spontaneously once an infant starts to crawl, even if the infant has never fallen. Its value is to prevent falls. This infant is being deceived by an illusion called a visual cliff, and so will not attempt to crawl onto the glass. The reaction is useful when there is a real cliff, but not in this context. The suckling reflex of the child and the letdown reflex of the mom are examples of type 1 reactions. Fetuses can be seen sucking on their thumbs in utero. Newborns do not have to be sent to sucking school to learn how to suck. Meanwhile, mom did not have to attend Lamaze classes to learn how to deliver milk when baby is hungry. The typical scenario goes like this. Baby is hungry, baby cries. Baby sucks on mom's breast. Mom has the letdown reflex. Baby is happy. After a few weeks of this ritual, mom says, "You feed the baby, I'm going shopping." At the mall, someone else's baby cries, and mom has the letdown reflex. It's not even her baby. The baby isn't even sucking on her breast. This is a learned reaction. Mom has learned to associate the crying of a baby with the letdown reflex, And now when anyone's baby cries, Mom has a dairy crisis. What we have here is a type 2 reaction, one that involves learning but is nevertheless uncritical, not appropriate to the context. These type 2 reactions, or acquired automatic reactions, are sometimes called Pavlovian reactions, after the Russian physiologist who studied them in detail early in the 20th century. Pavlov studied the reactions in dogs. He noticed that the dogs in his laboratory would start to salivate at the mere sight of the person who normally fed them, even if he brought no food. The dogs identified the person who delivered the food with the food itself. Similarly, Pavlov found that dogs injected with morphine would experience nausea and vomiting. After several experiences with morphine injections, the dogs would also vomit at the sight of the person who gave them the injections, even if there were no injections. The dogs had learned to identify the administrator of the drug with the drug action itself. Pavlov decided to do more formal experiments on these reactions. First, he redirected the ducts of the animal's salivary glands to the surface of their body so he could measure how much saliva they produced. Then he sought to teach the dogs a lesson. He rang a bell and fed the animals. Initially, only the food, but not the bell, elicited a flow of saliva from the animals. But after several attempts at pairing the bell with the delivery of food, the dogs learned to salivate at the sound of the bell, even if no food was forthcoming. Like mom's letdown reflex when baby cries, the dogs salivating at the sound of a bell when there is no food is a learned but uncritical reaction. Things got so bad in Pavlov's lab that they had to disable the doorbell. When Pavlov was finished with the animals, he sent them to the Russian Postal Service, where they provided saliva for stamps and envelopes at the sound of the bell. And after many years of experimentation, even Dr. Pavlov began salivating at the sound of the bell. Take a bite out of a lemon and you will experience a profound and even painful secretion of saliva. A school kid prank was to attend a concert, sit in the front row eating a bag of lemons. The horn players would salivate so profusely at the sight of the kids eating lemons, they could not play their horns. Get those kids out of here! Perhaps this photograph or my mention of eating lemons has you salivating now. This is a learned reaction because there is no lemon in your mouth, and it is also uncritical for the same reason. Type 2 reactions are the foundation of human neuroses, those annoying reactions that keep us from living life to the fullest. Many people won't get their vaccinations because they are terrorized by the sight of a hypodermic needle. They know the pain of the injection is trivial, yet they can't overcome their fear of the needle. When I was a child of about 8, I stepped on a nail in the backyard. My mother decided I was worth keeping and took me to the ER to get a tetanus shot. Our hospital was run by the Catholic Church, and many of the nurses were nuns who wore their black habits. When I saw the giant needle in the hands of that unlucky nun, I worked her over pretty good. At last she retreated and called for backup. a bigger nun arrived, and by the time I was finished with her, my footprints were all over her black habit. The nuns got their revenge by summoning the doctor from home. He arrived and was not in a good mood. This doctor was a survivor of the Bataan Death March of World War II. I could sense his bad mood, and so I just sat there and took the needle. My fear of the doctor trumped my fear of the needle. Many people can't stand the sight of blood, anyone's blood. They can't eat meat rare, or maybe not at all. And they can't become EMTs or work in trauma centers. They would be useless at an accident scene, needing medical attention themselves due to their blood phobia. Some people have irrational fears about flying in commercial airplanes. Isaac Asimov wrote more than 300 books in his lifetime. He was a member of Mensa, people who have extremely high IQs. Yet he was never able to overcome his fear of airplanes. No amount of data could overcome his fear. Many people have phobias about speaking in front of a group. They start to sweat, their hands shake, and they stutter and stammer. Their fight or flight response, however, is inappropriate because the situation is not a threat to their survival, and their response interferes with their performance. John Watson was a psychologist who decided to replicate on humans Pavlov's experiments with type 2 reactions on dogs. In one of his experiments, Watson used an 11-month-old child he called Little Albert. Albert showed no fear of the laboratory rats at the onset of the experiment. But Albert was afraid of loud noises, which is normal for infants, a type 1 reaction. So Watson decided to pair the presentation of the lab rats with a loud noise to see if he could teach Albert to fear the rats. After a few attempts, he succeeded. Little Albert began crying in fear when presented with a furry lab rat. But little Albert went farther. He also began fearing other furry things, including rabbits and even a Santa Claus beard. In other words, Watson had turned little Albert into a neurotic mess. The child was returned to the orphanage without therapy. We don't know for certain what happened to Albert, but one can speculate that he might have needed counseling in later life to overcome his aversion to animals and other furry things. Note that he would not remember the experience that triggered these type 2 reactions, but they could linger with him for life, diminishing his potential. That is why we would consider this experiment unethical today. If Albert had sought counseling for his neurotic reactions, he could ask the therapist to help him transform his type 2 fear reactions into a more flexible type 3 reaction. Reactions he could evoke voluntarily only if the details of a situation warranted. Let's speculate what a future trip to a psychiatrist might have been like for little Albert.
Phyllis, I want you to relax. The first visit always seems to be the most difficult. So, why don't you just settle in and get comfortable? And tell me what's bothering you.
I have a fear of spiders.
All right, well, that's a fairly common
That's
fear.
not all,
I'm sure we can
Doctor.
find...
When I'm standing on the street corner I have this fear that my bracelet will get caught on a moving vehicle and I'll be dragged down the street to my death. And I have a lot of anxiety about using the first tissue in an open box. When I eat in a restaurant, I keep worrying that the cook has spit on my food.
Yes. You know, I've had...
And whenever I'm driving alongside someone,
Yeah.
I keep thinking that they're going to shoot me. And,
Okay.
well, when I go to the bathroom, I can't stop imagining that a hand is coming up from the toilet and is pulling me in. I just know that there's a Soviet missile aimed directly at my living room. I'm afraid that what I perceive as my waking life is really a dream. And my dreams are really my waking life. I'm afraid that I'm going to get a disease, or give someone a disease, or see a photo of a disease in a medical book. Oh, God. When I drive through an intersection, I worry that I'm going to be rammed on all sides. And I'm afraid that when I look up into the sun, it's going to be a solar eclipse and I'm going to go blind.
Phyllis!
Yes, Doc.
Phyllis!
Yes,
Phyllis, I think I should say something now.
yes.
Your time is up.
I was afraid of that!
Little Albert and Phyllis need to replace their automatic, inappropriate reactions with type 3 reactions. Type 3 reactions are based on the principle of individuality, that no two situations are the same in all details. If we examine the details close enough, we can always find differences. These reactions are also called investigatory reactions. Instead of jumping to conclusions, we investigate the unique aspects of a situation. Think of the type 1 and type 2 reactions as a train on its rails. The train has little flexibility. It is canalized on its rails. The type 3 reactions are like an airplane, which has many more degrees of freedom than a train. The plane can go up or down, or to the left or to the right. It can land and taxi, and then take off again. Type 3 reactions are more flexible than the automatic reactions and sensitive to the unique aspects of a situation. These more flexible reactions are made possible by the complexity of the human cerebral cortex. Cortical neurons may have hundreds of synapses on their surface, and nearly half of these synapses are inhibitory synapses. They make it less likely an action potential would be generated. As a result, the human cortex allows us to delay immediate responses while we search for the details of a situation. Suppose some wise guy switches the I and the E on your keyboard. You're used to reaching with your left hand for the E and your right hand for the I. Without inhibitory synapses, you would be condemned to make the same mistake again and again. But with inhibitory synapses, you can block the reaction to reach for the E with your left hand, to evoke an alternative reaction to reach for it with your right. We delay one reaction to evoke a more appropriate one. We are trained and expected to stop when a traffic light is red and wait for it to turn green. This is necessary so traffic can flow safely and quickly through a busy intersection. However, suppose you're at an intersection where the red light is not cycling. Do you sit there in your car until the light is repaired? Or do you proceed cautiously through the intersection? The former would be a type 2 reaction, the latter a type 3 reaction. If you were driving a heart attack victim to the emergency room, would you sit through the red light until it turned green, even if there was no traffic? Or would you proceed cautiously through the intersection? If your demented spouse was after you with a gun, would you wait for the light to turn green? Or would you proceed cautiously but expeditiously through the red light? Type 3 reactions give us the flexibility to change routine behaviors when they would result in undesired outcomes. When you're in the doctor's office for a flu vaccine and the nurse comes toward you with a hypodermic needle, you sit quietly and take the injection. You judge the minor pain to be small compared to the potential benefit. But what if you were walking to your car in a parking garage and a stranger approaches you with a hypodermic needle? Should you roll up your sleeve? No, you run like hell. The context makes all the difference as far as which response is more appropriate. The degree of intelligence of a species is reflected in the ability to adapt to the unique aspects of a situation. In other words, to problem solve. This poor dog has wrapped its leash around a tree and as a result can't reach its food. A normal human could readily extricate themselves from this awkward situation and get their rewards. But dogs and cats lack the sophisticated nervous system to achieve the desired outcome. The intelligence of a species is reflected in how readily individuals can adapt to changing realities. In 1873, Dr. Carl Moebius performed a famous experiment that has been replicated many times. He put minnows in a tank with a pike. The pike used the minnows for lunch. If, however, we separate the pike and the minnows with a glass partition, the pike will attempt to get the minnows, but after striking the glass partition several times, it will stop. Later, when we remove the glass partition, the pike and the minnows will swim together without the minnows getting eaten. Later experiments demonstrated that pikes often will starve to death without attempting to eat the minnows. The lesson learned by the pike was rigid and inflexible. We say pikes are not very intelligent, or that they are not very adaptable to changing realities. If we replicated the pike experiment with a cat and a mouse, the outcome would be very different. Shortly after the partition is removed, the mouse would be history. We say cats are smarter than pike, or that cats have more flexible reactions than pike. Humans are capable of more flexible and factual reactions than cats, although we don't always demonstrate this. Our more complex nervous system allows us to use language and make subtle differentiations in the meaning of symbols in different contexts. No cat or chimpanzee or 5-year-old human could make sense of this sign. On its surface, the sign appears to be an oxymoron, with arrows sending us in opposite directions. But any licensed driver should be able to understand that it means the road curves to the left, so you better keep to the right to avoid a collision. Suppose your little brother starts tugging on your Goldilocks. You command, "Cut it out." So your bro gets scissors and starts snipping off your hair. You shout, "You idiot! I didn't mean for you to give me a haircut." What this reveals is that the expression, "cut it out," can mean different things in different contexts. Your brother inferred the wrong meaning, and that is a source of both tragedy and comedy. Here's an example of a fellow who must have gone to school only for recess. He just doesn't understand that words can have different meanings in different contexts. Take a listen.
Me out with the crowds. Buy me some peanuts, popcorn,
Beautiful package of Papa Jacks here.
Papa Jacks. Will you keep quiet, Sebastian?
Excuse me, please.
Sebastian, please. Don't interrupt my act. Sebastian.
Oh, Mr. Broadhurst, I didn't see the lights there. I forgot about them.
What in the world are you doing? Why interrupt my act like this?
Well, look, Mr. Broadhurst, I mean, after all, if you're in a ballpark, they always sell peanuts and popcorns and things like that.
I know that, Sebastian, but not in front of him. I beg his pardon, friend.
Ladies and
Please.
gentlemen, and also the children, will you excuse me for a minute, please? Thank you.
What do you want to do?
Look, Mr. Broadhurst,
Right? What are you doing?
I love baseball.
Well, we all love baseball.
When we get to St. Louis, will you tell me the guys' names on the team so when I go to see them in that St. Louis ballpark, I'll be able to know those fellas?
Well, now, is it all right, folks? All right.
Excuse me,
All
I
right.
want to find out the fellas' names.
As long as it's okay with the
I'm
audience.
crazy about baseball.
Will you stand still? Pick up your hat. Go pick up your hat.
Okay.
Now, look. Then you'll go and peddle your popcorn and don't interrupt the act anymore?
Yes, sir.
All right. But you know, strange it may seem, they give ball players nowadays very peculiar names.
Funny names?
Nicknames, pet names.
Not as funny as my name, Sebastian Dinwiddie.
Oh, yes.
Funnier than that?
Oh, absolutely. Yes. Now, on the St. Louis team, we have who's on first, what's on second, I don't know's on third.
That's what I want to find out. I want you to tell me the names of the fellas on the St. Louis team.
I'm telling you, who's on first, what's on second, I don't know's on third.
Do you know the fellas' names?
Yes.
Well, then who's playing first?
Yes.
I mean the fellow's name on first base.
Who?
The fellow playing first base for St. Louis.
Who?
The guy on first base.
Who is on first?
Well, what are you asking me for?
I'm not asking you, I'm telling you, who is on first?
I'm asking you who's on first.
That's the man's name.
That's whose name?
Yes.
Well, go ahead and tell me.
Who?
The guy on first.
Who?
The first baseman.
Who is on first?
Have you got a first baseman on first?
Certainly.
Then who's playing first?
Absolutely.
When you pay off the first baseman every month, who gets the money?
Every dollar of it. Why not? The man's entitled to it.
Who is?
Yes.
So who gets it?
Why shouldn't he? Sometimes his wife comes down and collects it.
Whose wife?
Yes. After all, the man earns it.
Who does?
Absolutely.
Well, all I'm trying to find out is what's the guy's name on first base?
Oh, no. What is on second base?
I'm not asking you who's on second.
Who's on first?
That's what I'm trying to find
Well,
out.
don't change the players.
I'm
about.
not changing nobody.
Take it easy.
What's the guy's name on first base?
What's the guy's name on second base?
I'm not asking you who's on second.
Who's on first?
I don't know.
He's on third. We're not talking about him.
How did I get on third base?
You mentioned his name.
If I mention a third baseman's name, who did I say is playing third?
No, who's playing first?
Stay off of first, will
Well,
you?
what do you want me to do?
Now, what's the guy's name on third base?
What's on second?
I'm not asking you who's on second.
Who's on first?
I don't know.
He's on third.
There I go, back on third again.
Well, I can't change their names.
Will you please stay on third base, Mr. Broadhurst?
Now, what is it you want to know?
What is the fella's name on third base?
What is the fella's name on second base?
I'm not asking you who's on second.
Who's on first?
I don't know. Third base. You got an outfield?
Oh, sure.
St. Louis has got a good outfield?
Absolutely.
The left fielder's name?
Why?
I don't know. I just thought I'd ask you.
Well, I just thought I'd tell you.
Then tell me who's playing left field.
Who is playing first?
Stay out of the infield.
Don't mention their names out here.
I want to know what's the fella's name in left field.
What is on second?
I'm not asking you who's on second.
Who is on first?
I don't know. Third base.
Oh, take it easy. Take it easy, man.
And the left fielder's name?
Why?
Because.
Oh, he's center field. He's center. Will you pick up your hat, please? Pick up your hat and
Look.
stop this. Oh, look,
Mr.
please.
Broadhurst.
Yes.
Wait a minute. You got a pitcher on the team?
Wouldn't this be a fine team without a pitcher?
I don't know. Tell me the pitcher's name.
Tomorrow.
You don't want to tell me the day?
I'm telling you, man.
Then go ahead.
Tomorrow.
What time?
What time what?
What time tomorrow you're going to tell me who's pitching?
Now listen. Who is not pitching? Who is
I'll
on?
break your arm. You say who's on first?
Why come up here and ask?
I want to know what's the pitcher's name.
What's on second?
I don't know.
Third
Third
base.
You got a catcher?
Yes.
The catcher's name?
Today.
Today. And tomorrow's pitching.
Now you've got it.
That's all. St. Louis has got a couple of days on the team.
Well, I can't help that. All right. What do you want me to do?
Got a catcher?
Yes,
I'm a good catcher, too, you know.
I know that.
I would like to play for the St. Louis team.
Well, I might arrange that.
I would like to catch. Now, I'm being a good catcher. Tomorrow's pitching on the team, and I'm catching.
Yes.
Tomorrow throws the ball, and the guy up bunts the ball.
Yes.
Now, when he bunts the ball, me being a good catcher, I'm going to throw the guy out at first base, so I pick up the ball and throw it to who?
Now, that's the first thing you've said right.
I don't even know what I'm talking about.
Well, that's all you have to do.
Is to throw it to first base.
Yeah.
Now, who's got it?
Naturally.
Who has it?
Naturally.
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 Okay.
Now, you've got it.
I pick up the ball and I throw it to naturally.
I know, you don't. You throw the ball to first base.
Then who gets it?
Naturally.
Okay.
All right.
I throw a ball to naturally.
You don't. You throw it to who?
Naturally.
Well, that's it. Say it that way.
That's what I said.
You did not.
I said I throw the ball to naturally.
You don't. You throw it to who?
Naturally.
Yes.
So I throw the ball to first base and naturally gets it.
No, you throw the ball to first base.
Then who gets it?
Naturally.
That's what I'm saying.
You're not saying that.
Excuse me, folks.
All right, I'm sorry, Frank.
I throw the ball to
You
naturally.
throw it to who?
Naturally.
That's it. Well, say it that way.
That's what I'm
Don't
saying.
get excited. Now, don't get
I
excited.
throw the ball to first base
Then
and
who gets it?
he better get it.
All right, now don't get excited. Take it easy.
Now I throw the ball to first base. Whoever it is drops the ball, so the guy runs to second. Who picks up the ball and throws it to what? What throws it to? I don't know. I don't know. Throws it back to tomorrow. A triple play.
Yeah, it could be.
Another guy gets up and it's a long fly ball to be called. Why? I don't know. He's on third, and I don't care.
What was that?
I said, I don't care.
Oh, that's a shortstop.
If you asked Sebastian Dimwitty to call you a cab, he would probably label you a cab. Words can mean different things to different people, and we need to be alert for these alternative meanings, or else we may communicate the wrong message. Suppose you ask me for a recommendation, and I submitted the following statements. You should feel lucky if you get this person to work for you. I can't recommend this person too highly. I'm convinced that no one would be better for the job. Note that each of these statements can be interpreted in contradictory ways. If your potential employer inferred the wrong meaning, you may not get the job. The fact that a word or phrase can evoke different meanings to different people and in different contexts makes communication a challenge. Here are some examples of words that are spelled the same but mean very different things and may even be pronounced differently in the context of a single sentence. The dove dove into the bushes. She wound the bandage around the wound. Captain, I had surgery on my left eye that left me with double vision. Notice we have three words that sound the same, and yet are spelled differently, and each have different meanings. Note that the first left refers to a side of the body. The next left refers to an outcome. And does double vision mean that you see twice as good after surgery? It's amazing we managed to understand each other. Suppose you encountered these three symbols. How might you read them? Here's three more symbols. How do you interpret them? Now look at both sets of characters. Note the central character is the same symbol. Yet I hope you interpret it differently in each context. Because the middle character is the same in both contexts, you should look to the context for guidance on how to interpret it. The human nervous system is capable of such subtle differentiations. According to Wendell Johnson, mouse traps work because to a mouse, cheese is cheese. They're not capable of subtle differentiations. If humans react as if 13 is 13 regardless of context, or if who can be only a question and not a name, then we are copying animals in our reactions. We are evoking type 2 instead of type 3 reactions. What do you see here? Most of you probably see a 74. But what does it take to see the 74? First, you must have been taught to read Arabic numbers. An ancient Roman would not see 74 here. Also, you must have all three families of cones in your retina. Most of us in the USA will see a 74, but there are people out there who will not see 74, and it's not because they are mistaken. What do you see here? If you were from a culture where there are rabbits but no ducks, you would probably see only a rabbit. If you were from a place that had ducks but no rabbits, you would probably see a duck. Instead of inviting the other person to the parking lot to duke it out for disagreeing with you, you should first evoke an investigatory reaction and ask the person for more details of what they see. Textbooks often ignore the inconvenient details that would contradict textbook generalizations. For example, on the left you see a textbook image of the urinary system. On the right, you see an X-ray of an actual urinary system in a person who appears to have an extra kidney and ureter. We all have variations not presented in our textbooks. I'm missing a palmaris longus muscle in my right forearm, and I developed only 29 instead of 32 adult teeth. We're all weirdos in some respects. We have to hope our doctors treat us as individuals and not as textbook generalizations. Unfortunately for Dana Carvey, his first heart surgeon treated him like a textbook person instead of a unique person. Carvey's heart did not have a textbook anatomy, and so he had to have open heart surgery redone. It cost the first surgeon $7 million, but nearly cost Carvey his life. To summarize, we are born with type 1 reactions and soon begin adding learned reactions. At first, these learned reactions are automatic, like the type 1 reactions. But as our brain, and especially our prefrontal cortex, develop, we can learn to delay our immediate conclusions while we investigate the details of a situation before drawing our conclusions. And we remain open to new data and changing realities that may cause us to alter our conclusions. We call these uniquely human reactions type 3 or investigatory reactions.